Hello, welcome to Life Path. I'm Dr. Melissa Brown, your host, and today we have a very exciting show lined up for you, and one of the most important things we're going to be talking about today is rethinking your drink. Stay tuned, we'll be right back.
This is one amazing truffula tree. Can you imagine a place where these grow everywhere? Yes, it's called the forest, a magical place to enjoy with your family. Ooh. So discover the forest and explore all the wonder that's there. Visit discovertheforest.org to find a forest near you.
Hi, thanks for joining us today. On the show, we're going to be discussing rethinking your drink. And with us now, we have Dr. Joanne Graham from CSUS, where she's both a faculty member and the director of dietetics.
That's correct, right? The dietetic internship program.
So thank you very much for joining us today.
Thank you for having me. This is a really wonderful opportunity for me to talk to you and your viewership about rethinking their drink.
Rethinking Your Drink is a very important campaign. It's now a statewide campaign, I understand?
Correct. Rethink Your Drink is a California statewide campaign that the Health Education Council's HEAL Collaborative is trying to educate the public on consumption of sugary sweetened beverages.
So what does HEAL stand for, Dr. Graham?
HEAL stands for Healthy Eating, Active Living, and it's a collaborative that consists of many partners over our 14-county Gold Country region in Northern California.
And the purpose of the campaign obviously is to tell people to rethink their drink. What does that mean?
What that means is, when we think of sugary sweetened beverages, we think of what we consume on a regular basis. Maybe it could be once a day, twice a day, maybe multiple more than that, or even occasionally. But what that translates to is quite a bit of sugar over time.
So you're really talking about watching the sugary content inside all types of drinks.
All types of drinks. And so when we think of our campaign to educate the public on trying to consume healthy options, water is one of them, that's what our goal is in regards to the Rethink Your Drink campaign.
So Dr. Graham, water is obviously the healthiest most sugar-free drink possible.
Yes, it is the sugar-free drink.
What about the soda drinks that youngsters in particular, and some of us adults, consume far too much of? How much sugar's in that?
Well, when we think about sugar, the research shows that the way we consume, Americans, get our added sugars is from sugar-sweetened beverages. And 46% of the American diet of their added sugars comes from sugar-sweetened beverages.
46%, that's nearly half of everything that we drink.
That's correct. And so let me give you an example. This is an average 20-ounce bottle of soda.
Yes.
It contains 17 teaspoons of sugar.
17 teaspoons. And if she's holding this up, you can actually see the little milky part of it. It's just all sugar, 100% sugar. Would people normally eat that?
Would you?
Raw? No,
Would you take
wouldn't.
A spoon and just go ahead and consume that in a matter of a minute?
Seconds.
Or seconds, exactly.
And then just think what happens when there are 2 or 3 at a time.
And then over time, just as you would in a week, if you were to consume one of those 20-ounce sodas every day,
yes,
this is what you would consume in sugar in a week.
A week. That's a couple of pounds at least.
That is a couple of pounds. And then let's talk about, okay, because soda consumption or sugary beverages is usually routine. This is what you would consume in a month.
This is a 5-pound sack of sugar. And this 5-pound sack of sugar is the amount consumed in 1 month just by drinking the sugary beverage.
Just by drinking a 20-ounce sugary beverage a day.
And which ones are the worst, actually?
The ones, you know what, they're, regular sodas, there's energy drinks. Those all have a significant amount of sugar, whether it is between 10 teaspoons of sugar per serving or 17 or 20. So over time, and we sometimes like to think about this in the health perspective over the course of a year, we think of how much this is in a year. This is a year's worth, and you had to help me lift this because this is 50 pounds of sugar.
50-pound sack of sugar over a year just from the things that we drink. Isn't that amazing?
And this is what's contributing to our obesity epidemic, because we aren't thinking anymore. I mean, we do think about lost productivity.
Yes.
We are thinking about healthcare costs, but we are also thinking about chronic diseases related to obesity, diabetes,
so we can
heart disease.
People can actually improve their health by consuming less of the sugary
Yes.
drinks. You wouldn't want this in your body if you had to eat it. So
No.
please rethink that drink.
Absolutely.
Stay tuned. We'll be right back with more of Life Path.
Bring out the action hero in you. Fuel up right and get energized. Be part of the greatest action movie ever. The first movie that puts you in the action. Show us how you train and eat like an action hero. Join in at actionheroalliance.com.
Hi, welcome back to Life Path. I'm Dr. Melissa Brown, your host, and we're joined by Dr. Joanne Graham from CSUS, and we're talking about sugary drinks. You know, I understand that they're dietary guidelines. How do they impact what people consume and drink?
As a registered dietitian and a public health nutritionist, we follow the recommendations of the dietary guidelines for Americans, and the 2010 guidelines specifically states that Americans need to reduce their intake of sugary beverages because they don't provide, they provide excess calories and they don't provide any essential nutrients.
So no essential nutrients. Is there a valid reason for consuming sugary drinks then?
Not
pleasure.
For pleasure. For pleasure. But the thing about pleasure is that it should be in moderation.
Yes.
And that is what's key. And the dietary guidelines for Americans is about moderation, consuming a variety of foods and beverages in moderation.
So consumption in moderation is very important. Is there some other reason why we should just focus on sugar?
Well, when we think about the consumption of sugary beverages in our community, in our counties, we have children, let's say whether it's Yolo County, Yuba County, San Joaquin County, between the ages of 2 and 11, they are consuming between 30 to 50% of one or more sodas a day. And when we think about the ages of 12 and 17, they're consuming like 50 to 78%, the greatest in San Joaquin County. So this is a significant public health concern.
So adolescents in particular consume entirely too much, 50, 70%,
Yes.
78%
Yes.
of the sugary beverages. They have negative health consequences, and a simple way is to drink water. What are other simple ways to counteract?
There are ways, and our counties are doing what they can to promote this initiative. The Rethink Your Drink initiative really is to teach communities, to teach schools, having through their health fairs, through their community programs. August 7th, there was a community event at the high school at Valley High,
Yes.
and they had a community potluck in which they promoted infused waters. They did.
So are infused waters better than the sugary drinks?
Absolutely, because it is water. Even though there might be fruit in it,
Yes.
they're consuming water. And we also had a big launch in San Joaquin that did the Rethink Your Drink launch there, and that was a big success with a soda buyback.
Well, we'll be right back with more of Rethink Your Drink and different ways of how to become healthier by becoming more responsible for your drinking. We'll be right back.